The effectiveness of intravenous iron supplementation on fatigue in non-anemic patients, a critically appraised topic, written by Jessica Keyser, MAT2, co-author Sasha Newkirk, MAT2, and faculty advisor Dr. Eric Warren. Iron deficiency, regardless of anemia, is a term used to describe a low amount of iron stored in the body in comparison to what is needed. Iron deficiency without anemia affects more than 2 billion individuals. This condition can present as a lack of energy or feelings of fatigue. Supplementation and diet changes are utilized to treat this condition. The clinical scenario for this paper is that there are many studies that investigate oral supplementation as a treatment of iron deficiency. However, there is a lack of research pertaining to how IV iron supplementation can be utilized for symptoms of fatigue. This topic was inspired by my interest in athletes who were iron deficient and utilized IV supplementation as a method of treatment. The focused clinical question for this critically appraised topic was, what is the effect of intravenous iron supplementation on fatigue in non-anemic patients? A search was conducted in October 2024 on PubMed, EBSCOhost, and Medline using the terms iron supplementation and fatigue and IV or intravenous. At the end of the search, there were 4 studies utilized in this critically appraised topic, but they had to meet the inclusion criteria of subjects that were non-anemic that utilized IV iron supplementation as an intervention. The literature had to be peer-reviewed and published within the last year in English and with human subjects, and it had to rank level 3 evidence or higher on the CEBM scale. The studies were not included in this CAT if they included anemic patients, did not utilize IV supplementation, subjects had comorbidities such as cancer or kidney disease, or studies did not evaluate fatigue. There were 4 studies utilized, 3 randomized controlled trials and 1 cohort study. The first randomized control trial, Woods et al., found that their participants at the end of their study had a decreased fatigue score on their brief fatigue inventory, which was a fatigue self-assessment scale. The second article, Arcarni et al., was a cohort study that utilized a fatigue severity scale and a self-assessment questionnaire that found participants had an improved score compared to the beginning of the study in the end. Keller et al. Was a randomized controlled trial that utilized a self-rating questionnaire and the numeric rating scale to determine their participants' fatigue and change in fatigue. This study did not support the answer, as the treatment group and the placebo group had very similar scores at the end of the study. Favre et al. Was the 4th study utilized. It was a randomized controlled trial utilizing the Piper Fatigue Scale and a computerized cognitive test to assess fatigue. Participants in this study were found to have reduced fatigue in comparison to the placebo group. In summary, 3 of the 4 studies reported decreased fatigue when utilizing IV iron supplementation. 1 of the 4 studies found no significant difference of perceived fatigue after supplementation. The clinical bottom line suggests there's a moderate support for the use of IV iron supplementation to treat symptoms of fatigue in individuals with iron deficiency without anemia. Based on the CEBM level of evidence and scores on the Pedro and JBI checklist, all the articles should be included in this critically appraised topic. This information can be incorporated into clinical practice as an intervention option for billions of individuals with iron deficiency.